Okay, great. We're recording. All right. So I think we're right about ready to begin. So allowing me to introduce myself, my name is Daniel. I am the president of the UNE APHA Student Assembly. I am one of the organizers of this event alongside our faculty advisor, Jennifer Seed, as well as a number of other wonderful individuals who I'd love to invite to introduce themselves.
Right. The vice president for you. I hope you enjoyed the.
Hi, my name is Amy Small, and I'm the secretary, and I'm thankful to have all of you here.
Hi, everyone. I'm Deborah Shields. I'm the director of the graduate program in public health here at UNE.
Hi, I'm Kathleen Welch, and I am an adjunct at UNE, taught global health and public health emergency preparedness.
I guess you want to introduce.
Go ahead, Ivan.
I'm Ivan Most. I'm also a professor at in public health here at UNE, and I guess I'm going to talk about work environment, occupational health, and environmental health.
Hi, everyone. Welcome. I'm Carol Ewan White. I am the assistant director for research and service in the program, and I teach maternal and child health. I'll be talking a little bit about that this evening.
And good evening, I'm Bethany Fortier. I'm an associate clinical professor with the undergraduate public health program at UNE. I'm really excited to be with you all tonight. I'm going to be talking about health education, among other things.
Wonderful. And so I'll be moderating kind of everything that's going on. I'll be giving our panelists a reminder at 6 minutes, and then at 1 minute, each panelist will have 12 minutes each to kind of go over their professional background, how they got into the background itself, alongside where they feel that their field might be going in the upcoming years, alongside what they would want a student to know about their background, and last but not least, how the pandemic has affected their field. So without further ado, I'd like to invite Professor Shields, the new program director, to kind of speak to her experience.
Hi, everyone. It's great to meet you. Thanks for joining us. I, like you, graduated into a pandemic, but the pandemic I faced when graduating was the HIV/AIDS pandemic, which certainly has not left us. I was an attorney at that time, and it was an incredibly interesting time to be involved in public health and public health law, because at that time, there simply were no anti-discrimination laws that protected people with HIV/AIDS. So I saw very up close and personal how discrimination deeply impacts someone's health. Those folks were denied access to health care, to dental care, to housing, fired from jobs, et cetera, et cetera. And there were very few confidentiality laws in place then. States had some, but this was even before HIPAA. So you can imagine how people closely guarded their privacy, because once an HIV diagnosis got out, people faced dire consequences. I can remember even having a client who became clinically depressed after being diagnosed HIV positive, and a well-known mental health clinic in the Boston area would not see him because he had HIV. So while we don't face that now, it is an incredibly interesting time to go into public health policy, especially, which is my area. Going into policy allows you to work on some of the upstream drivers of health, such as confidentiality laws or access to healthcare and non-discrimination policies. In my career, I was able to set up needle exchange programs and write the regulations when I worked at the Department of Public Health. I also ran, as an executive director, multiple public health advocacy organizations. So as a policy person, you can also do leadership positions. And in some of those positions, I was also able to work on policies such as regulation of carcinogens, especially those related to breast cancer, and was able to work with an organization in France on these sorts of issues. More recently, I was able to work on crisis standards of care during shortages of medical equipment, which we faced very recently during the COVID-19 pandemic, when some hospitals were running out of PPE or running out of beds or thought they were going to be running out of respirators. There were deep ethical and policy questions surrounding who would get that care in a shortage and who would not get that care in a shortage. And those are, gut-wrenching decisions to have to make, but it's incredibly exciting to be at the table and have the evidence and have the background to be able to take part in those discussions. It's such deep health equity and health disparity work. And you do not by any means need to be a lawyer to do policy. You can do a solid set of policy courses at UNE and walk away with some of the skills that you need. And folks who go into public health policy have an entire range of jobs they can go into. You can also often work for departments of public health. You can often work for state legislators because they often have public health committees within the number of committees in the legislature, and they need expertise. You can work for legislators themselves. And there's a whole myriad of different public health advocacy organizations, from the American Cancer Society to, national mental health organizations to, the CDC. And now I'm sure you can see that public health policy is in front of us every single day. Every time we put on a mask, every time we stay 6 feet apart, every time we follow any public health guideline, that's a policy that someone with a policy background created. So it's an incredibly rich and dynamic field now with lots of opportunities and lots of complexity. And it's rare that the public gets to see sort of the inner workings of public health in the way that they do these days during the pandemic. So this is certainly a field of enormous growth and enormous importance. And as we've seen from some of the president's infrastructure bills, they are trying to rebuild some of the public health infrastructure, which is very much needed. I'd love to take any questions you might have. You can either do it now or we can do it at the very end. But really, if you do not need to be a lawyer, anybody can be a public health policy analyst. Anybody can help draft public health policies. There's innumerable organizations that need that skill set. So I wish all of you really good luck. It's an exciting time.
Wonderful. Thank you so much. So I wanted to kind of open up the floor to the students to be able to ask questions. If you wouldn't mind sending me the questions and I can kind of moderate the questions, please send it to the real Daniel Higgins. I know there are a lot of Daniel Higgins in the chat. That was a little bit of an error. But once again, the real Daniel Higgins, and we'd be more than happy to shoot some questions. We've got about 6 minutes for questions.
Anything from anybody?
I can certainly ask some questions to kind of get things going. So, where do you think policy might be going in the upcoming years? What do you think? What sort of role do you think that policy will play in public health development?
Sure. Well, I think it's absolutely unlimited. I mentioned just some of the areas where there's policies, but policies are related to health insurance access, to Medicaid access, Medicare access. There's no field where there aren't policies needed. If it comes to, say, substance use fields, there's always people making policies around, say, harm reduction laws. To give a simple example, Suboxone is often used as a substitute opiate in a form of treatment. It, by law and by FDA policy, a doctor can only have a certain number of clients who are on Suboxone in their practice. It happens to be limited at 100. So somebody could get in there and do advocacy to make sure that it can be, say, 200 patients or 300 patients. Every single avenue has a policy angle. I used to do some oral health work, and I know one of the common problems that was just heartbreaking was that people who were low income on Medicaid could not get a full set of dentures, or they could only get them if the front teeth were pulled. But if the back teeth were pulled, you couldn't get them replaced. So that has a huge impact on nutrition and on health. So it's limited only by people's imaginations. And it really is a great way to work on the upstream drivers of health. For instance, during the pandemic, we've seen that there's been a moratorium on eviction. That is one of the great upstream drivers of health. And working in policy and law is a great way to enter that arena and to know how to use the evidence, in a savvy and ethical way, if you will.
Yeah, wonderful. So we do have a question. What kinds of organizations work with public policy?
Oh, so very many organizations. I can tell you some of the ones I've worked with, like the National Alliance on Mental Illness. There's any number of state public health organizations. There's any kind of cancer organization works policy. All kinds of AIDS-related organizations. Any specific disease always has a policy arm. And as well, and policy can also include budget. You can do advocacy around budgetary issues, asking for more money, say, to cover diabetes care, or to cover, when you're talking about health equity issues, a lot of that is policy development.
Sorry, one more question. Sorry.
Sure.
What are the first steps to obtain a job as a policy analyst?
Well, I would say take as many courses as you can. And if you can do a practicum or internship at a policy organization, that can also be really helpful. And then, the same way we all find jobs is to look at some of the organizations you're most interested in, look at the APHA job board, look at postings at your state public health organization, and take it from there. And you can also do, of course, what do you call it? The informational interviewing. That's what I'm trying to think of.
Oh, okay. Great. All right. So we make sure we give everybody their good amount of time. So first off, thank you so much, Professor Shields.
Sure.
Wonderful to hear about policy. So we're just gonna move on just so we have a little bit of time for everyone. So next we're gonna have Dr. Ivan Most, who has worked in all sorts of fields in public health. So without further ado, please take it away, Dr. Most.
I'm just going to see if I can get my slide. Here we go. Daniel mentioned at the beginning that he thought his career was going to be more of a straight line approach. And that's what I thought mine was going to be when I graduated from college back in 1964 also. I was going to be an engineer. I was going to go to work for a large corporation. And I was going to retire at some point and get a gold watch. And that was the career back in 1964. Well, as you can see from my little chart here, while I drew a straight line here, my career did this, which is far from a straight line. I graduated from college in the early 60s, got married to my college sweetheart, and we started a family, moved to Schenectady, and I became an engineer for General Electric, like I thought my career was going to start. And that was pretty good. I was working for a part of the company that made nuclear reactors for the Navy. I transitioned up to South Portland, Maine. That's how we moved here, to make heat exchangers for land-based nuclear power plants. And that all came to a crashing end in 1993. If anybody's old enough to remember 3 Mile Island, and the nuclear power industry in this country went to sleep for 50 years, unfortunately. So I started to change my ideas about what I wanted to do. And I started to do some research in high temperature heat exchangers and other more advanced types of heat exchangers. Heat exchangers are basically devices that exchange heat from different fluids to make things happen, like make turbines run or make houses get warm, so on and so forth. So they're a very necessary part of our life. In the process, I started my own engineering firm. I am a professional engineer. I'm registered in 4 states. I should say I had certification in 4 states. I'm not registered anymore because I'm retired. And I did start my own engineering firm. That engineering firm, though, moved into a different area. As you can see, my career has done this up and down. It got into the environment, where we looked at how do we convert waste products to energy. And so I got into the environmental aspect of engineering. And then USM decided to start an engineering program, and they asked me to help out in the starting of the program. So I consulted with them for a year, and then I took on a position with them as director of a department that was going to help small businesses in the state improve their manufacturing capability. And this is where the public health starts to come in. As I looked at our manufacturing base here in the state of Maine, and I was asked, how can we improve our productivity? I found out that the biggest problem these companies had was in workers' comp. The insurance rates were going sky high. Workers' comp insurance companies were leaving the state. It was a combination of bad policy and bad health. When I looked at these companies, I discovered, the people getting injured. And part of the reason was because of the poor design of the workplace. And so I got really interested in how do you design the workplace so you don't injure workers. And that's where my trajectory of my career moved into the new century with a degree in work environment from the University of Mass Lowell, my doctorate, and a lot of postdoctoral work looking at different industries and how you could improve the health of the worker. Occupational health is kind of a stepchild of public health. We work a third of our life in the workplace, and the workplace has some exposures that are much more severe than you might get in general living conditions. And so it's not unusual that we leave the workplace with genital or chronic diseases and injuries that plague us the rest of our lives. So I've really developed that interest, and I've developed it more into a teaching and research mode at this point. Now, somebody might ask the question, how does an engineer get into public health? So I've put something down here which maybe will give you a little bit of an idea. The profession of engineering has a code of ethics, like many professions have. The first canon of the code of ethics for engineering is the whole paramount, the safety, health, and welfare of the public. So there really is a very direct link to public health and engineering. And many people that you'll find in fields that you might think are not really related to public health are working in occupational health. You might find these people working for insurance companies. You might find them working for hospitals, but in a little different area. You might find them working in the safety committees of hospitals, trying to prevent back injuries, especially of nurses, which is a huge, huge problem. Recently, we're doing some research at UNE with the dental school, looking at why dentists and dental hygienists cut their careers short because of back and shoulder injuries that plague them throughout their life, and they finally decide they just can't get into those kinds of postures anymore, and they stop working. So I am working with the dental school and with the physical therapy department on a research project. We've already done a phase 1 of this project. We're going to be proposing to actually a workers' comp insurance company a phase 2 of the same project. So occupational health is directly related to public health. It's directly related through a number of factors, and it's because the workplace is our primary place where we reside for a good part of our life. Now, how do I feel it's going to change in upcoming years? Well, I'm going to combine this with the last question about the pandemic. The pandemic has forced a lot of us back into the home as the workplace. Now, that's going to make a big difference because the workplace in this country is defined as a workplace. It's a place where you go to work. It's not defined as the home. So there's going to be some policy issues that are going to have to catch up with this issue. In other countries like Sweden, which has got socialized healthcare, they don't differentiate between the workplace and the home. Your health is taken care of no matter where you get injured. In our country, if you're injured on the job, workers' comp insurance takes over. If you're injured at home, health insurance takes over. Well, what happens if the home is a workplace? I raised the question, I don't have an answer, but I think it's going to be ripe area for the policy people in the future. I really think if you're interested in workers, in occupational health as a field of public health, you'll find jobs available in workers' comp insurance companies. These people are called loss control people. They actually work with clients to help them understand how they can redesign their workplace to slow down injuries or eliminate them totally, therefore getting a lower insurance rate. You'll find that you can work in hospitals on safety committees, in manufacturers on safety committees. So there's a number of possibilities that are not in the traditional public health mode where you can make yourself very, very useful and find some very useful and rewarding career in public health. And I think the pandemic has kind of accelerated this idea a little bit because a lot of people are working longer hours, especially in the delivery business, and they're working under a lot of stress. And so one of the things we talk about in occupational health is psychosocial stress leading to physical injury. And it's a real thing, and it's something that we can do something about. So if you're interested, I'd be glad to answer questions about occupational health. It may be a strange area to think about when you think about public health, but it is there, it's useful, it's growing, and it's a real need. So I'd be glad to answer questions now or later. Daniel?
Wonderful. Thank you so much, Dr. Most. What a nonlinear career indeed. It seems that life happens when you plan. So now I want to give the opportunity to have somebody ask a question. So if anybody has any questions, please feel free to shoot one. Okay. So Dr. Most, if you could briefly kind of go over how do you think COVID has affected this specific field, and how do you think it's going to rebound?
Well, as I said, a lot of people are working from home. It's changed the idea of, especially for office work, we might call white collar work, that you do not necessarily have to be in an office. The office environment is not always very conducive to health, as my students have discovered in the occupational health class, because we've looked at an office environment as one of the cases that we study. But is the home, and that's another question, is your work site set up so that you can really do your work without suffering any physical consequences of that? I think that the pandemic has also given some cause for people to think about some of the people that are in direct contact with us, the EMTs, the people that work directly with people that are getting COVID, and how are they handling their job when the pressures are mounting for numbers that they have to cover and for the amount of shifts that they have to handle. We know that in public health that working long hours is not conducive to productivity. We also know that it's not conducive to eliminating errors. So there's an awful lot to be thought of as how we use people in their jobs as the staffing gets tight. And this is something that the occupational health people have to really think about, because once a person gets an injury, like a carpal tunnel syndrome or a back injury, they can be out of work for a long period of time. So we want to do what we can to prevent those kinds of injuries. Can we use mechanical devices? Can we use artificial intelligence? Can we use a number of other ways of getting some of this work done that don't require the use of people in direct contact? So
Wonderful.
I think the pandemic is going to give us a lot of cause for thinking how work is done in the future.
Great. Thank you so much, Dr. Most. I really appreciate that. So we are going to move on to Dr. Carol Owen White, who has a wealth of experience and will be talking about her experience in maternal health and public health. And that's my dog.
Thank you, Danielle, and thank you for that, Ivan. It was very enlightening. So I'm going to be talking about my work in maternal and child health. And what's my professional background? I am someone who, I do not have an MPH, but all my work has been done in the field of nutrition and epidemiology with a focus on mothers, children, the family, women's health. So that's my connection. So I am a research scientist by training. So I have a PhD. I don't have an MPH. So I happened on public health in that I did my bachelor's in biochemistry and physiology and parasitology. So real labby, very lab centric. And then as I was finishing up my bachelor's, I realized that I preferred working with people than test tubes and centrifuges and all of those things. So for my master's, I was introduced to a lovely group at the university where I was that is all about child development. So I got a job with them as a graduate research assistant. And I stayed with them for 13 years before I migrated to the United States. And while I was with them, I did my master's, I did an MSc and an MPhil, and then my PhD, all within that same group, with all my focus being on child development. And so maternal and child health became my focus. And then I came to the United States in 2006. I'm from Jamaica, if you can't tell from the accent. I came to the United States in 2006. I worked at Brown University for a little while. Then I came to Maine, where I worked at Maine Health as a research scientist. And in 2016, I landed at UNE in the public health program. So that's a little about my background. And now I'm gonna just let everyone know, I'm gonna do a trigger warning here because we're talking about mothers, babies. So it tends to, evoke emotions that they're mostly positive, but some can, these are kind of sensitive areas. So just be aware of that. So I switched the order a little, Danielle. So I'll talk about what a student should know about MCH. And then I will talk about where I think the field is going. So what is MCH, as we say, maternal and child health? As the name implies, it's the discipline where you work with mothers and children. But a lot of people think of maternal and child as starting at pregnancy, but it doesn't. It starts long before pregnancy. It starts from the day of conception. So it's important for us to look at it as, how is that girl doing? What is the developmental stage of that girl? Where is that girl? What's the nutritional status of that girl? So that every pregnancy can get off to a positive start. So think about all the life stages, from in utero to infancy to toddler, the school years, adolescence, puberty, all the changes that happen there, menarche, the start of the menstrual cycle, and all that happens there, family planning, contraception, and then you move on to the pregnancy, which, as you may know, 66% of all pregnancies are unplanned. So that's a big part of maternal and child health, which is why it's important that every woman in the childbearing years is aware of their nutritional status and where they are, because when that pregnancy happens and by the time you know that you're pregnant, that developing fetus systems have already developed before you even know you're pregnant. And if that happens in an environment that's not conducive to the best outcome, there could be long-term consequences from that. And that's all a part of MCH. So it's understanding all what happens throughout the life cycle of the girl who becomes a woman, who becomes a mother. And of course, within the context of MCH, you have to think about the socio-ecological model, because it happens within the interpersonal space. Decisions aren't made by just the mother. They're also made, with the family. Do you have a child? What about family planning? What child spacing, child rearing? All of those things are done within the context of the family, and it takes a community to raise a child. It takes a village. So then you move to the other stages. So you see the community is important. So you have to think about the social determinants of health, where that mother and the children are living. What's gonna be the impact on their health? What about access to care? What about trauma? Is it a safe environment? Is there gonna be violence? What's the long-term consequences of violence during early childhood? Then we have the economic part, which is a big deal, because there's access to health care. Do you have health insurance? Is there food in the home? Because as we know, when children are growing, proper nutrition is very important.
6 minutes.
Thank you, Danielle. Proper nutrition is crucial. So you have the growing body that needs all these nutrients. Is there access to the food? So you have all of these as part of MCH. And then, do I think the field is going? One of the things I would say is, as long as they're women and as long as women have babies, there's always gonna be a need for public health professionals to work in the field of maternal and child health. So it's a field that will always be around. And it's a very broad field. It lends itself really nicely to allow you to overlay whatever skills you have on your area of interest. like one of the big thing that's happening right now with COVID. So I'm gonna like merge what the pandemic has done with this, is that it's a she session for, and it's called that for a reason, because most of the jobs lost were to women, because women tend to work in the service industries. They're face the public with the jobs they do. The nurses are mostly female. The respiratory therapists are mostly female. So the cashier, mostly female. So there was a big economic impact on women. And many households with children are headed by women. So just think of the consequences of the food insecurity. Back in 1944, there was a Dutch famine, and studies on the population then showed that when children are conceived or born in a situation where there's sufficient food, which means inadequate nutrition, there are long-term consequences to their health outcomes. Are we going to see that now? Is that going to be one of the consequences of the pandemic? So time will tell. So the pandemic is going to lend itself to MCH, looking at long-term, medium, and long-term consequences of insults that are happening now to the children. There's an increase in suicide, suicide rate among adolescents. Is that going to continue? What happens to these women and girls who had to stay home with their abusers because we had to shelter in place? Is there going to be long-term consequences? Babies learn by looking at the impression that's on your face as you interact with them. When you're wearing a mask, they can see the smile. Is there going to be long-term consequences to their development from us having to wear masks, from us having to hold them a little less because we're social distancing? So all of those are going to be things, I think, that this pandemic is going to have people looking at. Then we have the age-old things of there's no paid maternity leave in this country. So you can work in policy with this. There's no place to pump when you have to go back to work because there's no paid maternity leave. Mothers are going back to work within days of delivering a baby in this country. Where do they pump? In the bathroom stalls? All of these things. Are employers going to be asked to have dedicated spaces for mothers to pump? So there are policy things that you can work on. There are research things you can work on. As I said before, it just lends itself beautifully to using research skills, policy skills, health education skills. If you work like with SNAP or the WIC program, helping mothers with low income to stretch the dollar and to do so to make sure that they're doing balanced meals for the children, because nutrition is vital during the development stages. So there's just so many things you can do with in the maternal and child health field. Whatever you think about, chances are you can do it. So I could go on forever and talk about this, but I will pause now for any questions.
I think we're gonna just hold questions until the end, if that's okay, just because we want to make sure we can get to everyone. And I do have a question from a student, so we're gonna save this one for the end. Thank you so much, Dr. White. That was so beautifully said, and I think you shed a really big spotlight on maternal and child health care, which I think was awesome. Thank you so much.
Thank you, Danielle.
All right, and so we are going to move next to Dr. Kathleen Welch, who is going to speak to her experience in public health emergency preparedness and global health and whatever else she'd like to kind of touch base on. So without any hesitation, Dr. Welch, and you're on mute.
Well, thank you, Daniel. It's so great to see everyone and former students I really wish you the best. I've really enjoyed teaching here, and global health I've taught the most, and then public health emergency preparedness. I think it's great that the Carol and even Deborah went first, because I follow along in that same trajectory. Like with Dr. Even Most, it's a nonlinear path. I didn't start in public health. I was chosen by public health when I was in my mid-30s in Russia, in the former Soviet Union. And that's because my background is I have a bachelor's in Russian language and literature and a master's in foreign language education. And I was fascinated by perestroika and the Russian history, and wanted to be there when it happened in the early 90s. And at that time, some humanitarian aid agencies were also coming in, and they needed someone that could speak Russian to lead survey teams that conducted population-based nutritional surveys throughout the former Soviet Union. And they liked that I had a graduate degree. They liked that I spoke Russian. So that's how I got into public health. And I had to really learn to be flexible and how to delegate and network, because I didn't have a background in public health. So at the same time, there was a group of people from the CDC in Moscow, and I started a conversation with them in a bar at a hotel and explained to them my needs, and they came on board, and it was fantastic. We had real success with really some of the first population-based surveys over there. So that's how I got into public health, and like Dr. Shields, I entered, my first real job in the US was during the AIDS epidemic. So like Dr. Shields said, I saw, just the stigma and the disparities. And I was very, very thankful, though, because like some of you have said, I was able to work on my MPH and my PhD because I had a job at an HIV/AIDS clinic, and they paid for it. And I just became more and more fascinated by public health, and working again with the CDC in their adult spectrum of disease study, looking at the role of opportunistic infections when a person has HIV or AIDS. And back then it was, again, it's just so much stigma. And I became a very strong advocate. And I saw later on in New Orleans, when I was working there, I saw, again, the Black population so much affected. And we started to work with Black women, and also provide free HIV testing as much as possible. So there was I don't know if you know about the Essence Festival, but it's a big festival in New Orleans, and we provided free HIV testing. So I'm really, really believe in policy and advocacy and being creative, because I think we have to, yes. That's the way we make change. And, you have to integrate, so many fields. That's why I have this multidisciplinary field, and I want to reach out to you and say, whatever you have in your background is going to be helpful. That's why public health is so exciting. And I ended up in Maine teaching at UMF and working as an evaluator. And again, I've done a lot of advocacy work with the environment. I led a group of students to DC to work on stopping oil drilling in the Arctic. Worked on the Arctic National Wildlife Refuge Project, and never believed that we'd still be fighting for that now. This was a long time ago. So you have to keep up the work, keep up the fight. And then after, it's funny, because then we moved back to New Orleans after Katrina, because we wanted to help out after Katrina. And that's when I started working with the State Office of Public Health HIV/STD program. And I learned, again, how do I segue into public health emergency preparedness? Because my professional career has been not linear. So what I did is I did a lot of work as far as a volunteer. And let me stress that being a volunteer is a great way to learn. But I also worked with the HIV/STD program as far as looking at ways to make sure that the patients could have a full supply, an advanced supply of antiretrovirals before the hurricane hit. Simple steps like that. Well, it's not so simple, but Katrina changed everything. I mean, it really did. And so let's see. So then what did I do then? I came back to Maine, I think. Are we moving back to New Orleans? No. Then I came back to Maine. And this time, it was right at the time of the, it was the year before the pandemic. And I've just, helped out again with volunteer work as far as Maine Response. It's a volunteer agency where you can get public health experience and emergency preparedness. And I've also worked with the Alzheimer's Association as far as looking at vulnerable groups and working on a state plan to really help those with dementia and Alzheimer's during an emergency. Let's see, another volunteer opportunity. I actually, well, this is strange, but I actually helped, in Russia during this crisis, but the US came in with MREs from Iraq, the first Iraq war, and we were distributing those, which I had
6
very much
minutes.
feelings about. 6 minutes. Okay. So I've had a lot of different experiences in my life. And I just want to say that you need to just be creative, open to a lot of different changes. And I think this is the best time to be in public health. I can't tell you, I listen to Dr. Shah religiously every Tuesday and Thursday. If he isn't the best spokesperson for public health right now, I don't know who is. He is great. And I just want to end with this quote that Dr. Frieden, who was the former CDC director, said, "If this isn't a teachable moment right now, there will never be a teachable moment. Our livelihoods depend on it." So we have so much that we can do and learn. And the Public Health Emergency Preparedness course is now with HCA. And it's interesting because it's going to have this interactive scenario. So you learn through this scenario of a hurricane crisis and how to work together, because the program in Public Health Emergency Preparedness really looks at how you can be a leader in a time of crisis and public emergency. And one of the traits I think is most important is to realize you need that team. You are a leader, but you have to listen. And as we saw with this pandemic and who was in charge during this time, thank God we have someone else. And I'm sorry if I'm political, but we need to be, and we need to fight. All right, that's me.
All right, thank you so much, Dr. Welch. Yeah, you've had a very interesting career. So interesting to see you move from Russia back to the U.S., down to New Orleans, back to Maine, back to New Orleans, back to Maine. You're ping-ponging all around the world. So we have some questions building, but like I said, for the sake of time, and we want to make sure everybody's going to be getting the chance to speak, we're going to move forward and we're saving those questions. I have them all here and I'm writing them down as well. So next, we're going to be moving to Professor Bethany Fortier, who's going to be speaking about health education. So thank you so much.
Yeah, of course. Thank you. And I feel like parts of what I'm going to be saying is a broken record. And it's kind of interesting. The five of us feel like public health kind of found us in many ways. I started out as an undergrad at the University of Maine at Farmington, not doing any type of health at all. I actually was going to be a social studies teacher of all things, and coach track and field at the same time as a lifelong runner. And during my sophomore year, my cross country coach at the time was like, you should really, I know you're really interested in history and that's important. It is, but you really should, it seems like your passion is in health. I was kind of personally motivated by relationships in my own personal life and was kind of experiencing frustrations. Like I want to be able to help them if they could just kind of raise their awareness, provide education and things. So I knew I always wanted to be in the field of education per se, but kind of really switched my trajectory my sophomore year as an undergrad and started focusing on community health. So that's what my bachelor's degree is, in community health and psychology. I had the benefit of right as I was graduating, I had an internship, and this is where Dr. Most and I crossed paths, I think maybe 18 years ago now. So it's been a little while and I'm dating myself, but worked at the Maine Cardiovascular Health Program doing worksite wellness with Andy Spalding and crew. So working
Oh.
with, yes, large and small
I knew you looked
businesses.
familiar.
I know.
Did you work
That's
with, did you work with Peter Duran also?
I did. Yep.
Oh, good.
Yep.
Great.
So have a couple years on me now, but at that time with the bachelor's, I knew I really wanted to enter the workforce. I was kind of, in all honesty, burnt out from going to school for so long and kind of fell into a master's in public health. I started taking the graduate certificate in public health here at UNE and just kind of fell in love with the coursework, fell in love with the interconnectedness between the professional education and really getting that real life experience hand in hand. And throughout my career, I've been in the field now for almost 18 years now. It's brought me all over the place. Again, I echo what my fellow speaker said. I feel like I've ping-ponged all over the place. So starting at the cardiovascular health program, worked nationally around providing training to different organizations and businesses around social marketing. From there, went to work in healthcare administration a little bit with the education focus. So educating not only providers and healthcare professionals, but also community members on a variety of different topics, ranging from tobacco to lead poisoning to nutrition, kind of you name it. I felt like I was educating on everything. Moved from there to public health emergency preparedness. So very similar to Dr. Welch, where got to develop public health emergency plans and test them within the city of Portland, as well as Cumberland County, and then spent the last remaining years before becoming a full-time faculty member in community-based coalition work. So a big piece of all of this has been this education piece. We know that really health education helps to empower individuals and communities to help live healthier lives by improving not only their physical health, but really addressing their mental, their emotional and social health by really increasing knowledge, increasing awareness, and hopefully influencing attitudes and kind of preconceived notions and beliefs. I find that health education really connects research, theory, and practice all together. Again, not saying education in and all solves the world's problems, but I found in my experience that really taking that time to talk with folks, figure out kind of what are the root issues or concerns or things that are kind of on their mind and being able to address them accordingly. We've seen with the pandemic kind of this influx of misinformation and disinformation, and people aren't sure where to go for credible, reliable information. We know that there's a lot of issues related to health literacy, people being able to understand and digest and use health information, health
6
education.
minutes.
Big role for that. My gosh, time goes by fast, huh? So just found that to be one of the common threads throughout my career is the importance of health education. People need to know how to understand health information and understand how it applies to their everyday life. So really health education by and large is really involved in the promotion, restoration, and maintenance of health. In terms of kind of growth in terms of the health education field, I was reading, I know there's really overall in public health, there's a need for passionate, skilled public health professionals that is on the rise, and it's become apparent very much so with the pandemic. We know that I believe it is the US Bureau of Labor Statistics indicates that a projected 16% increase in the need for health educators and community health workers, which education is a big part of that, it's projected that increase is going to be needed through 2026 and beyond. We know that with education is coupled with kind of challenging disinformation and misinformation. People are hungry for reliable, credible information, and us as public health professionals need to be those people. We need to be those reliable, credible sources of information. In my career, I've utilized quite a bit, not only stress the importance of health literacy, but also utilizing motivational interviewing. That's my one of my wheelhouse areas, is being able to engage in a collaborative conversation with people, figure out kind of what's going on beneath the surface, that iceberg kind of metaphor, and be able to act appropriately. So I think the field is growing. This is an exciting time to get into the field of public health. There's so many things that you can do, and health education is one of them. So I thank you for your time, and I think I'm under the wire with my time. So thank you.
Wonderful. Okay, thank you so much, Beth. I really appreciate your insight as a public health educator and on your speaking to your experience in the public health field. So before we jump to questions, Amy Small is going to plug one of the individuals who, or highlight one of the individuals who's unable to make it tonight. So without further ado, Amy.
Hi, again, my name is Amy, and I'm the secretary of the APHA Student Assembly. And I just wanted to let you know, or Tracy wanted to let you know, as a friendly reminder, the UNE graduate programs in public health has a dedicated career services expert to support you in achieving your academic and professional goals. Our assistant director for career services is Tracy Spinato, and she's who was unable to make it this evening. But she's excited to share some of her career resources available to you. And she's available for one-on-one consultations, coaching, career exploration, resume reviews, interview prep, and strategic planning for both your academic and career goals. These services are available to all students and alumni. I've used her services. She's phenomenal. She made my resume look amazing. So she says to book an appointment to email her directly, and I will put that email, I will put Tracy's email in the chat box so you can look for it there.
Before we go to the questions, if Olivia can introduce herself. I'm Jennifer Seedy. I serve as a faculty advisor for the Assembly. And Olivia, if you could take a moment to introduce yourself.
I'm Olivia. I'm the campus liaison and the treasurer, and I'm an undergraduate public health student.
Wonderful. Thank you so much. So we're going to jump to questions, and then at the end, if you wouldn't mind participating in our poll, that would be greatly appreciated. So we're trying to figure out where we can possibly take this next year. So right into questions. This one was posted in the chat. I might have missed this, but how important do you think it is to receive an MPH designation to working in public health, either in a research or government agency capacity? Do you think a master's in the science in e-health would be beneficial to someone interested in improving public health outcomes through innovation rather than being restricted to an MPH, as long as you take the basic epidemiological and foundations to public health courses? Yes, Dr. Shields.
Well, my personal opinion as someone who has an MPH is that an MPH is incredibly useful because you have a very broad skill set. And when it comes to improving health and health outcomes, you need a whole variety of disciplines and skills to bring to bear on that issue. There's many ways of doing it, but personally, I think that an MPH gives you the broadest set of skills possible. Thanks.
Wonderful.
I would agree with that. The only thing I might add is that if you're thinking about getting into research, make sure you have strong skills in biostats and epidemiology. The scientific, the quantitative pieces of the puzzle are important, and they can't be ignored.
I would also jump in and say I agree with that as well. And just thinking about it, kind of going to Dr. Mose's point. So you can, with the MPH is definitely a broader approach, and you can also think about kind of concentrations or different areas that for other professional development. So for instance, one of my passion areas is health education, obviously. I did get my certified health education specialist certificate in 2018 through the National Center for Health Education credentialing. So that's something where if you're wanting to kind of focus in a niche area, you can certainly do that. But I would definitely agree, looking at it, MPH will give you the broadest and most involved education that you need to be a public health professional.
Wonderful. Okay, moving to the next question. Are there any journals or professional associations that you would recommend students become familiar with when starting out their careers? Yes, Dr. Shields.
Many of you could probably answer this, and the first one would be, of course, the American Public Health Association. They have they have great journals. They publish the nation's health. They have all kinds of fabulous conferences and mini trainings. They have an awesome network of folks from all across the country. And then if you are in a specific area of public health, for instance, I am in a lot of networks about public health law and policy, or public health and mental health, or public health and gun safety. There are usually organizations for that. You know, you can do Google searches for the areas of your interest, but the APHA is really the umbrella one.
And I just want to add that every state has a PHA. So like you have the Maine Public Health Association, the MPHA. So you can look within your state to become a member of your state's association, in addition to the APHA. And what I want to say with the APHA is that there are student arms, so there are discounts for students. So if you join while you're still a student, you pay less than if you wait until you graduate. So I would encourage you to join as soon as you can, but also think about your local version of the Public Health Association.
And if you're interested in getting more specific into the occupational health area, the National Institute of Occupational Safety and Health, which is the federal government agency that develops policy, the Occupational Safety and Health Administration administers those policies, or they're the regulators. But NIOSH has an excellent website, and they have lots of publications on that website that can be very interesting for you.
Yes, and I want to agree with all of you and say that also there's a great Maine Emergency Management Agency, and actually there's a way you can take free trainings with FEMA and get certificates in public health emergency preparedness. So there's so many trainings available on different, different sites. And I can't remember, but the Maine CDC is working with offering more trainings too. So the Maine CDC has a lot of trainings.
And I would just jump in and say the national CDC has an enormous number of trainings that are incredibly helpful across a broad array of topics. Really, really useful site.
All right, wonderful. Thank you.
I'm sorry, Dan, before you move on to the next question. So the poll is open. 20 of you have already responded, so thank you. 100% of you so far said you'd like to see more events like this. But I'm also curious about question 3. Did this event help you identify a public health discipline of interest? So if you don't mind, I'd like to see what you're thinking about, those who are attending. If you could just type that discipline in the chat box. I'm just curious to see who pitched the best discipline out of the group. And no, I'm kidding. It was all fabulous. It was all fabulous. But I'm just curious to see where everyone—
Policy.
Wonderful. Thank you so much, Jennifer. Okay, so moving on to the next question, and I'll let the panelists speak, and then I'll also put in my 2 cents afterwards. How could a person going to physician assistant school or medical school get into a public health career, specifically MCH and global health / emergency preparedness?
Many universities allow for dual degrees, either in medicine and public health, or nurse practitioner in public health, or physician's assistant in public health. We would love to develop that here at UNE. We don't currently have one, but it's certainly possible to enroll in one program and then enroll in the next, which we greatly encourage. But those with more background in MCH might certainly want to jump in.
Can you repeat the question, Danielle?
Yeah, of course. How could a person going to physician assistant school or medical school get into a public health career, specifically MCH and global health / emergency preparedness?
Right. So I would say if the program allows it, you could do your research or any independent study or, any of those activities with a focus on MCH. So that way you could get, you start to understand what the field is all about. And then if you can do your internship in a part of MCH, that will help you to get into that aspect of it. Because as I did where I was trained, it was part of a medical school. So all the people around me were MDs, MD, PhDs, or, very clinical people as well. And that's how they did it. They did research. So you intern with a MCH researcher, and you get your networking going, and that way you can get into the field that way without having to do even a formal concentration in MCH.
Wonderful.
And I wanted to say again, the volunteer work you can do. I know doctors are very, students, medical students, everybody's very, the time is limited, but you could volunteer for, say with Maine Response has a lot of doctors, nurses, and retired doctors and nurses. So, there's always change, and there's always ways to improve your, what your skill set.
It seems like I remember having students with DOs and MDs, but they were probably already had their degree. So I can't believe that. It doesn't sound like they were doing a dual degree program. They were doing it after the fact. I don't know if we have a dual degree program at UNE. Deborah, it doesn't sound like we do.
No, we don't now. We did in the past. We'd love to develop another one, but we do not currently have one.
So I'll be starting medical school in the fall, but I just wanted to note that there are a number of student interest organizations. Also, during your rotations, you can do electives specifying in neonatal care, maternal care, disaster medicine, and even going into residency, you can do what's called the Global Health Fellowship. Dr. Shields, if you want to talk about working something with the medical school, I'm more than happy to help with that.
It has a little bit to do with schedules.
Of course. So this next question is specifically for Dr. Welch. How do you get involved into emergency preparedness?
Well, like I said, I did a lot of volunteer work, and I just happened to experience it personally and had to learn that way. Let's see, I was during Hurricane Gustav, I got my first MRE, but I learned how to use resources with FEMA when Hurricane Isaac tore off our roof in our condo. So I'm saying these were personal experiences, but the best way is to volunteer. So I didn't have a professional job in public health emergency preparedness, but if you're teaching global health, if you're working in other fields in public health, you always have to know about emergency preparedness. As I said, as an HIV/AIDS epidemiologist, I had to really look at every plan and make sure that we were reaching out to the most vulnerable and that we were prepared if there was a natural disaster or any kind of disaster, be it that they have their medications in advance. So I think public health emergency preparedness is, look at where we are now.
Yeah.
I would just also like to add that I did a lot of emergency preparedness when I worked for the State Department of Public Health. Even though that was not my particular area, there was an enormous ice storm in Maine years ago that knocked out power for 2 or 3 weeks. And there was major concern that there was food insecurity and lack of heat in some of the most remote areas. So I and someone from the CDC Epidemiology Intelligence Service the coolest name for a job ever, right? Like, can't you just picture them in these James Bond kind of outfits? Anyway, I went outside of Norway, Maine, to people who were living in trailers who were heating using their stoves, which of course is a real risk for carbon monoxide poisoning. So when you work in a state public health organization, you have the opportunity to jump in all kinds of situations.
Awesome. So another question for everyone, and I think this is a very important one, especially for the current time that we're living in. What are some suggestions for becoming a better advocate? Dr. Schultz?
There are a lot of advocacy and policy trainings online, including at the CDC, as well as different policy organizations. And it usually helps to volunteer or link up with some of the advocacy organizations. And one could, like Planned Parenthood is an advocacy organization. Mass Breast Cancer Coalition is an advocacy organization. American Cancer Society, to some degree, is an advocacy organization. The Alzheimer's Association has an advocacy arm. So again, volunteering can help. You can also look on the websites of your state public health associations. Like I know in Maine, they have some great background materials on how to do advocacy. So there's lots of resources out there. And certainly taking courses in it is useful, but anybody can advocate. It's really about talking to your legislator. And some of the process is really demystifying it. But we all have the smarts and the drive and the passion. That's what legislators like to hear. They like to hear personal stories. Some of them like to hear a lot of evidence, but it's often the personal stories about an issue that really brings it home, that changes hearts and minds.
I'd like to add what Deborah was talking about. The personal stories are extremely important. Listening to people, when I started to really get interested in the work environment, and I went through through many factories, and talked to the workers, some of the people's perceptions were that, oh, people that go out on workers' comp are just playing the system and all that. What I found was just the opposite. There are so many people working hurt and not reporting, and getting the cultural change to take place that gets people the right to say, I hurt and I need help, is a big problem, especially at these times when people are afraid of losing their jobs. So listening is an important part of being an advocate. And with the skills you have as an MPH graduate, you have those skills to listen. And sometimes you're going to hear things you're very surprised about.
I'd like to report that people are chiming in on the chat, which, discipline they are most interested in. And it looks like a really nice mixed bag. So well done to all of you. But you can go ahead, Daniel, with further questions.
Great. So we have one last question. And they say, I want to know where new MPH graduates can get jobs in the emergency preparedness field, or do we need to acquire a certain amount of experience?
Well, I was looking at different sites, because like I said, I don't have a professional job in that area at any time. But I want to say that I reached out to Carol, and I reached out to Tracy Spinato. And I also realized that the Maine Emergency Management Agency, if you want to stay in Maine, you could go to maine.gov, and they have jobs listed. FEMA will have jobs listed. Homeland Security, of course. But I think, and I've just found this personally. I mean, there's so many resources here at UNE, but personally, I've found that the Public Health Employment Connection at Emory is amazing, because you can look at each type of job, each industry, each state, each country, plug that in, and they have a updated list of jobs. And I was looking up that job site, and they had one for an emergency management supervisor outside of Atlanta for the airport, because it's the largest airport in the country, and they want to make sure that they're prepared if there's another outbreak, a contagious disease or whatever. So those are just some tips.
All right. So any other questions? Okay, I think that's it. Real quick, I'm going to give us 2 more minutes to, if you haven't entered the poll, please do, or maybe just 1 more minute as I wrap things up. I just wanted to once again give a big thank you to the panelists, Dr. Moos, Dr. Shields, Dr. White, Dr. Welch, and Professor Fortier. You have been a wealth of information and shared your wealth of information with all of us, the student body. Perhaps some of the faculty learned something new, and it was just so wonderful to have this diverse group come together and talk about their passions, these fields, and the beautiful collection that is public health in itself. We do have a couple of things I wanted to point out. So if you want to follow us on social media, we are on Facebook and on Instagram. So you can grab those with the QR codes up on the screen. But if you have any questions whatsoever, you can feel free to email us at the aph-board@une.edu. And we would be more than happy to answer any questions, or even help facilitate communications with one of the professors if need be, if we couldn't answer those questions. Once again, I want to thank the other members of the Student Assembly, Professor Jennifer Seed, wonderful faculty advisor, Amy Small, Mackenzie Amadei, Olivia Rando. We couldn't have done this. It was an absolute collective effort, and I just wanted to further extend my thanks to them. And once again, the panelists, we hope to have you return if that's something you're interested in, to share your experiences with other students. And with that being